energy, funds, resources, and people to be there. So we're kind of... Well, these guidelines are really confusing for the general public, for the political leaders, and for the healthcare establishment. And the reality, though, is, which I will say sort of in favor of the changing guidelines, is that they're evolving based on our learning new information about this dynamic. And I think that's really why we have so much confusion. On the other hand, we are dealing with a very confusing time of trying to find that right balance between what the science, the pure science, is telling us, and some of the public pressure and anxiety that exists around Ebola. This has got to be stopped in Africa, otherwise we're going to end up with problems. We're kind of harming ourselves in a way if we do things to discourage doctors and nurses from volunteering with let's say, Doctors Without Borders. We want people to go, and I know for a fact that doctors will consider a mandatory quarantine a problem, and many will decide not to go because here they are volunteering 4 or 8 weeks in a very dangerous environment in Africa, going to come back and then face 21 days lockup, even if they don't have symptoms, they don't have Ebola. Actually aggressively prevent the spread, to treat patients, and so forth. So I would say reassurance that the governors and political leaders need to do, and base policies on as much on science as you possibly can. So we weren't really